How to use Kinesio Tape to improve sporting endurance. I'm Dr. Michael Lee, certified Kinesio Taping instructor, here checking in with you on a Monday afternoon. And thank you so much for joining me today, because the answer to this may surprise you, because you're probably thinking, Kinesio Tape, sporting endurance, how do these two marry together? Because let's think of it this way. When muscles become injured, it's due to fatigue. And when something fatigues, it's because it's been overloaded over and over and over and over and over and over again until something has to give. And when something gives, then of course, that's where we have the inflammatory process, the acute pains, the acute injuries. And that's why most athletes and patients fear the most, because they have the initial pain. But the real question is that, how can we use something like Kinesio Tape to prevent? Because always remember, prevention is better than cure. If we can prevent things, of course, more people can start enjoying the things that they love doing without really thinking, oh, but what if I do this? What if I do that? What if I overdo this? But because then they get to actually understand and learn more about their bodies. But your role as a clinician is, of course, understanding your patient from top to toe. Because if you're one of those clinicians that you're thinking, yeah, I just need to understand the anatomy of the knee, the hip, the ankle. I'm just a knee expert. I tell you what, when we have orthopedic surgeons on the courses, when we have a knee surgeon or a hip surgeon, and they tell me, oh, my anatomy doesn't go higher than the hip, I tell them this: you are disrespecting your patients, because you need to see the whole picture. Yes, it's great being an expert in one area, but you tell me, since when has the body said, oh, I only need to use, I can work without the rest of the body? It doesn't work that way, and particularly when it comes down to endurance sports like running, Tour de France cycling, swimming. Tennis is an endurance sport. Things that actually just happen for a long period of time. At the end of the day, the whole body needs the whole system, because you must remember this saying, and I want you to remember this, particularly when you're assessing your patients in the future. The patient is only as strong as their weakest link. Whatever's weakest, it will break down. It will break down over and over again. And the chances are that weakest link is something that's been overloading time and time and time again. But the question you need to ask yourself is, why is it overloading? If you don't know why it's overloading, guess what's going to happen? It will just keep overloading over and over and over and over again. So usually when something's overloading, it's because something isn't working. So that's why when we apply tape, particularly Kinesio Tape, we have two major abilities, and incredible abilities that have been found out by Dr. Kenzo Cassie himself, the inventor of Kinesio Tape, is that Kinesio Tape can facilitate a muscle. So that's the first thing. When I talk about facilitating a muscle, if something is tested weak and it's tested that actually it's hypotonic, so it's not firing on all cylinders, just applying a bit of tape onto the skin in the right direction at the right tension, suddenly you test the same muscle again. Oh, why is it strong? So it can actually facilitate the things that are weak, but also it can inhibit the things that are overactive. So if something is overactive, because it's on all the time, it's obviously doing the job of other muscles that are not working. But this is the problem. If you're a manual therapist, a chiropractor, physiotherapist, osteopath, sports therapist, you've been trained. You have been trained to think, I need to release things and manipulate things, massage things, trigger pointing to release them. I'm going to tell you now, very honestly, stop doing that, because it's the wrong way of treating a patient and finding what's causing the problems. Because you got to think this way: you release it, how soon does it get tight again? How soon does it get stiff again? A few minutes, an hour at tops maybe. Even with stretching, how soon does it get stiff again? Yeah, it gets stiff very quickly. But don't get me wrong, yes, you can keep stretching until you change it structurally. That's possible, but it takes a long time. But if you're not finding out why it's bracing in the first place, it's going to brace anyway. Because just think of it this way: if 60% of the muscles are working really hard and 40 of them are not working at all, the 60 is doing the job of the 40. That's what it has to be on. That's why no matter what you do by manipulating something, guess what? The brain still needs to switch on the 60 that are not working to protect the 40 that are actually not working. So this is where you must facilitate first. Tape the muscle, the nerves, to facilitate first. Then guess what will happen to the muscle that's tight? It will let go anyway. Because the thing that it was doing a job for that wasn't working is actually now working. It has no reason to do the job of other muscles if they're already working. If that makes sense, put MS into the chat, because this is This is one of those common problems that we see with students, that they just don't, they've been trained the wrong way their entire lives, through university, through all the short course. They need to release things, but the truth of the matter is that you need to facilitate things first, and if something is structurally tight, then release it. But you cannot release first. You release first, guess what? The thing that's tight, that's been stabilizing everything, because you already know there's other muscles not working, and you then release the things that are stable, guess what? You create gross instability. Now, why would you want to create gross instability? Because when you create gross instability, what then happens is that high risk of injury. Why would anyone, any clinician, want to create that for a patient? This is the power of Kinesio Tape. Make sure you facilitate the right muscles first. Once you've facilitated, then the things that are actually tight and bracing and hypertonic, they'll let go anyway. So that's why you don't need to worry about those. But essentially, yes, if you need to do structural work after that, do it afterwards. But you must facilitate first. So I hope that you're actually learning a lot in this session, because ultimately this is why we love actually doing these live trainings. These live trainings is to actually challenge your thinking, that don't just follow the herd and says, oh yeah, they're doing that, that means I've got to do that too. We need to think logically, what's actually happening with this patient system and why it's actually happening, because if you don't find out the why, it's just going to keep happening over and over and over and over again. So I really hope that you found that this is really, really helpful. But we are actually doing a live training, and if you have been, and if you are interested actually in learning to find the causes of what's actually happening in someone's pain and eliminate it immediately with Kinesio Tape, then we're actually doing a live training actually very, very soon in December. We do have a Black Friday offer. So if you want that offer, I think it's 90% off the original course price. Just put me into the chat and one of our team will actually contact you and give you that special offer, because it's only happening over the Black Friday weekend. So take advantage of that, because once those seats are filled and other people have actually taken advantage of that 90% off, because we're only doing it on Black Friday, then we only can serve the ones that come first, of course. So if you want to take advantage of that Black Friday offer, put me into the chat, and of course, I will see you soon and give you even more knowledge of how to truly help your patient get out of pain for good. Thank you for joining me today. I hope you have a great week, and I look forward to seeing some of you very, very soon. Bye for now.